Oh man, I thought I cleared my phone. Yeah, so June 30th, I came for the tests, after the virtual clinic appointment with Dr. Broyer from 2 days ago, the 28th. And I come to the lab window and, they're talking to each other, and it's hard to kind of get them to finish their conversation, pay attention to me, the patient. And then one girl goes on her phone, and then another staff comes and he's on his phone, just leaning back behind them. And it's kind of gross to know what phones really are contaminated with, to see medical staff wearing that, touching those. And you can tell it's not super important what they're doing, right? It's not like they're checking to see if somebody they really care about is okay, or it's about catching up to their addictions. After about 10 minutes, because I'm the only one sitting in the hallway there, I go and check and say, hey, should I go get is it going to be long? Should I go get... By the way, last time I did a video from here, the engine was running for a while. It's because it hadn't run for a while, okay? I'm not going to start it now, but this engine, if I don't want to stall, this older, bigger engine needs to be warmed up properly. And you don't want to stall here and restart it when people are trying to get in and out in this tiny little spot. So I go and I say that, oh no, I'm working on it now. It's like I had to get her going, like she wasn't finished with it. So finally, a Filipina girl that wondered what I was doing there, I said, oh yeah, I already went to the window. Comes out. And then the conversation with her is that I have to train her. And I end up... some things she's not sure. I say, can you stop looking at the screen, because it'd been about 5 minutes of bad communication, and look at me and be in this conversation. And so I could find out what she knows, doesn't know, what she's sorry, I don't know what this is, or what it checks, and I forgot that part of my training, whatever. And but then I say, well, this is what I'm here for from the conversation from 2 days ago, which was recorded, so I can confirm this is what I'm expecting, right? 2 different stool samples, subjects, and blood tests of at least hemoglobin, red blood count, but also it turns out she wants to check things like iron. So she made me a photocopy, like I asked, of the requisition. And if they have our emails, why can't we get this stuff? I want copies of my own medical records. And if it's done right, and cross-reference it to a conversation, and who did the crappy communication? Because now the parasite or worm is just written as a diagnosis question mark, but it's not checked off underneath, so she can't even give me a container. The guy gets my email on the phone to send it to me to see if it's faster. And he's getting it wrong, and I have to correct him with the spelling of the email. And it's, we have the language, but not attention span to compensate for, let's say, English accents, and effort and listening skills. And I told her after, I said, why you had to repeat my medical care card number so many times is on our cards, you'll see it's 4 numbers, 3 numbers, 3 numbers. You were splitting it up in a different way. It was confusing people. It's not like criticism of you. It's just feedback for you to improve your communication. Split it up in the 4, then the 3, then the 3. It's better like that because it's the more common way to do it. And if it isn't, it should be. It should match with the way our brains work. That people can't separate it the way they feel like it. Everybody's doing it differently, right? It's like T for tango. You can't go say all sorts of things like a name that starts with a T from a culture you don't know just because it fits you, right? It's the same type of common sense. Split it up in this way. Anyway, she did call. Now, virtual health, it wasn't directly to the number of the doctor, it was virtual health. And they're going to get permission from a doctor, maybe not the same one, to send a new requisition. So now she did the blood tests. Man, she's going really fast. Needle, boom, in, boom, do. For her, it's almost like a dummy she's practicing on, like this, very little, okay, you're going to feel a sting. There's nothing like that, right? First time somebody, boom, boom, bada boom, bada bing, I'm just here for the paycheck. But after I'm checking with her, I say, oh, how long have you been here? Is it hard for you to find housing? I know how to do the bedside manner. I did it at the end because it's not my job to do it, but also it's like I had to advocate for the patient, right? Because I'm the only patient-centered person that shows up. This is it's so redneck, it's so uncaring, it's so staff talking to each other, and then if there's nobody there to talk to as another staff, is they'll go on their phones. There's very little understanding that they work in medical field, and that some people are, curious. They're wanting to ask questions. They have worries, fears. They kind of, it helps relieve their fear if you kind of make chit chat. This is beyond the abilities of, and this is one of the worst places. But I'm not saying other places meet human standards. They don't. But I'm saying that a lot of people might want to move from here, and a lot of doctors might not want to work here when they see the lack of professionalism in people with seniority that have been training other people. Okay, and also the lack of things to do. No movie theater, no badminton club. The pickleball group is awesome. They update, they use their Facebook group, they do tournaments with other cities. Badminton here is allowed to die. Shame on you.